Is this thing on? Testing 1, 2, 3. Hello, Pet Nation. Michael Dr. T. Tequila here, and today I want to talk to you about my personal experiences with having a senior dog, namely my dog Holly, undergo an anesthetic procedure and what's involved in that. And I kept on thinking about it. I was worrying about it, and I empathize with those of you who have senior pets and you're worried about your veterinarian doing an anesthetic procedure on them. But I wanted to talk about the concept of trust. And speaking of which, Holly, come here. Holly, come here. This is my girl. She's coming over. Come on, girl. Come on. Oh, hello. Do you want to say hello to the camera? I'm going to lift you up. Do you want to say hello? Oh, did I wake you from a nap? I think I woke her from a nap. Okay, baby. You can chill here as I talk about you. So what had happened was a little over a week ago, Holly needed a dental. She needed a dental. We call it a dental prophy if it's just a dental cleaning. And I knew that she probably had some teeth issues. So I knew she probably needed an extraction. Yeah, one of her teeth had to come out because there was an infected root. And which is another story we can talk about. I can talk about how dogs can have dental disease and not show any clinical signs about that. So it's not like they're going to show major clinical signs. It's all involved in the dental procedure itself. We could do a whole new video on that and the importance of utilizing digital dental x-rays to see what the tooth looks like. Right, cutie pie? Okay, now you're going to distract me for this whole video, but that's okay. That's what dogs are about. So what it boiled down to was, and I mean trust, and what I mean by trust is, are we dealing with a situation in which we trust the protocol? We trust the team, and that goes several ways, from both a client perspective to a doctor perspective to a fellow team perspective. And do we trust the actual person performing the surgical procedure, namely the doctor? And what I'd like to talk about is developing that trust too. So from whether it's from a client perspective, you the general populace, pet parents out there, to actually the team members themselves within the practice. So first and foremost, do you trust the protocol? And by that I mean, this applies to any anesthetic protocol. By that I mean, do you trust what the whole protocol of anesthesia is? And there's general concepts and rules that most of the veterinary practices follow. I believe many want to follow that, but may not be capable of actually developing those. And so I think it's something that we need to talk about. So number one, that a dental procedure is an anesthetic procedure. It is a surgical procedure. There's no doubt about that in a pet. And I could bring on every board-certified dentist I know will tell you to avoid these non-anesthetic dental procedures. Again, that's another show. So let's just talk about the anesthetic procedure itself. In which case, my role as a pet's physician is to make sure that I take a good listen to the heart to make sure there's no cardiovascular issues going on. If there is, we want to get to the bottom of that and determine if a pet is able to undergo an anesthetic protocol. The second, so it's a full physical exam you do. Not only do you do it previous to the actual recommendation of a dental, because that's how it comes about during the physical exam, but you do the day of. You make sure that nothing has changed between when that dental was scheduled or the anesthetic procedure was scheduled to when that day actually happens. Secondly, our role as a veterinary medical team is to perform a pre-surgical blood panel. So to look at the blood is a window into your pet's body. Physical exam could be completely normal, not finding anything major on physical exam, but you could have changes in the level of white and red blood cells. You could have changes in the organ function, namely kidney and liver are the main anesthetic clearers, and lungs as well. So it's important to do a physical exam and get the full blood panel there. So if the veterinarian team does their proper protocols, then that is a major hurdle to overcome. And don't get me wrong, there could be minor medical issues going on. There could be somewhat more moderate medical issues going on. But if your pet is stable and well managed, then that discussion about doing anesthesia is definitely there. And the senior aspect. So I always tell clients that in our human world, you hear more and more about senior people undergoing anesthetic protocols. Hip replacement, knee replacements, anything that requires major anesthesia. And those protocols, the quality of the anesthetic protocols are so high now that the risk is nominal. I'd be lying to say there's no risk in any anesthetic procedure. There always is a risk. Let's take the approach that we want to minimize that to almost a 0%. So there is risk. It's an anesthetic procedure, but we minimize the risk by doing a proper physical exam, by doing proper blood work. If there is a medical issue, we are working it up and getting to the point where we have the okay from, I usually want a cardiologist to give me the okay about a heart for anesthesia. And if there's a medical issue, we want to make sure that we're stable enough that we can make the qualified decision that yes, we can undergo anesthesia. And for the senior pets, it's different. And what I experienced personally is not necessarily the procedure, but the post-procedure. So senior pets, senior people get a bit more stress. So it was a stressful event for her to be there. It did take longer, as is the general rule, for her to recover from an anesthesia. Literally, it was 24 hours plus before she was able to kind of be herself, so to speak. She became very stiff during the procedure. It was difficult for her to climb stairs afterwards. She is arthritic. I do have her on preventatives and, when necessary, pain management, but she was pretty stiff, and I had to sleep downstairs with her. So those are things that young pets you really don't exhibit. I think everyone's different from how they clear the anesthesia and how they wake up and how they are the next day, but it was something that a senior pet, it just takes longer. So you need to know that as a pet parent. We need to know that as veterinarians. So I have a particular protocol for senior pets as far as what anesthetic induction agents or drugs I use and what the actual inhalant anesthesia drugs I use. And every vet is different, but the key is you tailor it to the pet, whether they're old, young, or other, and you make sure that you give to effect. So when I go back to trust in protocols, is what sort of protocols do you have the day of anesthesia for your pet? And so that's very important. You want to make sure that your induction agents are up to date. You're using the best, latest protocols that you give these induction agents. So induction is when you give an agent to the point where you can actually get the breathable endotracheal tube in them so you can do gas anesthesia. And so you want to give those induction agents to effect because everyone is different. You can calculate a dose for anyone. My aunt always says that Asians take less anesthesia, so when she had her hip replacement. So it's one of those things you give to effects. You're not giving the full dose. You might need more than calculated dose. Some pets are like that. You need to know that. And you do everything to effect. And then anesthesia protocols. Any anesthesiologist will tell you it is not a constant thing. You do not set the levels and walk away. You set the levels and you are continually monitoring and engaging those levels depending on your varying the depth of anesthesia, depending on the pet's parameters. You have to make sure you have the proper protocols for monitoring the patient. You have to make sure you have the trained, qualified person there monitoring the patient. So trust in the team. So I trust my team, and by team I'm gonna separate the doctors right now. The team, I'm gonna talk about the veterinarian nurse, and I trust my nurses are trained and competent to monitor anesthesia. And it is key for any surgical procedure that you have someone monitoring and then you have someone doing the procedure, whether it's a dental cleaning, whether it's surgery. So typically it's the doctor doing the procedure and it's a veterinarian nurse doing the monitoring of anesthesia. If you just have one person there, you completely eliminate the ability to monitor properly and you increase the risk. So when I started practicing, I heard of problems, possible death under anesthesia. A lot of time it was what I call human error, and a lot of times it was because there's one person involved. The doctor was both monitoring anesthesia and performing the procedure, and I can tell you that is impossible. I listen to that heart rate. I'm hearing the beep, 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 and the breathing and everything like that. But I have to concentrate on what I'm doing, and I can't look and monitor that continual variable anesthesia. So you have to make sure you have a proper team member there that is trained and qualified. So you as the pet parent out there, you have to trust in that veterinary nurse or trust in your veterinary crew, your veterinary clinic, that they have the proper trained people. So veterinarians out there, it is important to make sure that you train that individual. Veterinary nurses want to do this kind of thing, and I know that monitoring anesthesia is the top line. So get your team to that level where you have numerous people that you can just rely on, that you can monitor anesthesia, and things will go better. Trust me, things will go better. And finally, it's trust in the doctor. So in my particular case, I chose the individual that I wanted to do her surgery, namely because I've known her for a very, very long time. She actually did the first surgery on Holly. Holly had a mast cell tumor on her knee, and Jen Bruce did the surgery, and I wanted her to she's an excellent dentist as well, so I wanted her to look at the other bumps that Holly had to have removed. So it's trusting in your doctor. Make sure you develop that trust. So you as the pet parent, you have every right to have questions about the anesthesia protocol. You have every right to ask for a tour of the back to see where they do the procedures, what kind of monitoring systems they have. It's very important that you have that trust. I want my clients to, when I say, listen, Coco needs an anesthetic procedure, we need to clean the teeth, I probably have to take some extractions, I want them to say, yeah, okay, let's do this. I want them to have the ultimate trust in me, and I develop that trust through my relationship with my clients, my relationship with the patient, and the quality of the team that is presented at the practice. So veterinarians out there, veterinary owners, managers, it's important to, again, train your team, have that qualified team, have them well educated about the entire process, from what a dentistry is to what the anesthetic protocols are, what the pre-surgical protocols are, and monitoring under anesthesia, and everything will go well. So it's all about trust. So it's been a week and a day. I can tell you that she is completely back to normal. I have been lucky, knock on wood, that she has been very good. When I leave her alone, I put an e-collar on her. When I'm here with her and we're monitoring her, she is not going at those sites. That is amazing. She's got 3 surgical sites, well, 4. She has a tooth removed and 3 lumps removed. She is not going after that site. Maybe it's because she's a golden, and goldens are like that. But a lot of pets get that obsessive compulsive, and they'll go after that site. So that's why e-collars are recommended and are there. And proper go-home protocols, pain management, antibiotics when needed, maybe extensive pain management, maybe extensive protocols afterwards, and a recheck appointment. Fortunately, I can do the recheck appointment. I can take the sutures out myself, but everything went well. But it's all about trust. Trust in the protocols, trust in your veterinary team, trust in your veterinarian. Listen, if you're just new to this station, I'd love it if you could subscribe. I hope this was entertaining and educational for you. You can reach out with any questions or concerns. Definitely talk to your veterinarian. Drill them with questions. I love the client that drills me the questions, that keeps me on my toes, because that makes me a better veterinarian, and that's make sure that my protocols are in place. Have a tour. Do all those things. And veterinarians, be open to this. It's very important that we have that open relationship to our clientele and their patients. And remember, everyone, love your pet like they love you, unconditionally. Have a great day.